trust is at the core of building any brand. And what any brand can learn from the health category is that to build trust, you actually have to be transparent. Actually, how the democratization of information has really changed the relationship between the doctor and the patient. And so as marketers, we really have to think about what does that mean to our ecosystem when it comes to content, when it comes to building brands. And so if we think about that for a second, that it used to be a very patriarchal system, and now it's a very participatory system, that consumer has a lot more power in making decisions. What's interesting though is that the consumer, there's a little bit of a misnomer of empowerment. That word gets thrown around a lot. And people want help in making decisions. They want to understand information. And if information is just thrown at them, that's not necessarily understanding. So our job as marketers is actually to ensure that that information is digestible, is clear, it's defalsified, there's no fake news that's embedded within it. And when you have that responsibility as a marketer, you're therefore going to be able to inform patients better, they can make better decisions, and they will have better outcomes. We have gone through an incredible transformation in health, and we are about to go into even more incredible transformation. So when we think about how data and health and where it's going, there's a lot that is on the horizon. First of all, interoperability of data is going to be a really interesting way of us controlling, learning, and taking all those different sources of human and clinical data to understand our situation better and to inform consumers better. But I think one of the things in the future that's going to become table stakes is a value equation and a value exchange. And what I mean by that is I'm sharing my data with you as a brand. What am I going to get from you in return? If I'm going to share when I got the flu and what were the symptoms that led up to that flu, how am I then going to get from you what you're going to give back to me to make my life, my experience better? And that value exchange is going to then create a new currency, which is really anticipatory health. Right now, what people care about is understanding simplicity and personalization. And where we see things going is through that value exchange, anticipating when you're going to have a flare from Crohn's disease, when there's going to be an allergy attack. And that's going to be the greatest value of all, trying to be much more proactive versus being ambushed by health issues. Data is sacred. This is very intimate. People understanding your clinical data about who you are, your health trajectory, it is something that people hold very sacred. On top of that, just your regular data of where you go, what influences you, why you go there, and how you're influenced, people want to understand transparency around that. And also how your data is being used. We have a great example with Estonia. And Estonia is quite an advanced system because they've really upheld the thought of transparency, trust, and control. And that as people understand how their data is used, they have the choice to share their data or not. And it was really the first kind of formative years of thinking about blockchain, because the privacy around data in Estonia is something that is absolutely crystal clear that you cannot integrate your data without your choice.